Coronavirus has changed all of our lives, but how will it impact our future? Does this change everything? I'm Janelle Simplinsky. On this episode of Does This Change Everything? Healthcare. How does the coronavirus impact healthcare? How will it change healthcare services in the future? And how will these changes be financed? We'll find out more from Tunde Szabo, a healthcare economist at the European Investment Bank. Tunde, you've been battling the coronavirus for almost 18 days now. Can you tell us what it's like and how you found out you had it?
During this coronavirus crisis, I'm right now based confined in our apartment in Madrid. The emergency state was announced in Madrid on the 13th of March. And this was exactly the day when my 16 years old daughter fell sick. She started complaining, "Oh, Mom, I feel very tired. I have headaches. I have very sensitive eyes. I need to sit down. I cannot go anywhere. I'm very, very tired." Then we discovered that she had fever, and then she got very frightened, and she said, "Mom, I think I have the coronavirus. Could we call the coronavirus hotline? I asked for a test. I would like to get tested." So I told her, "Elena, don't worry. Let's wait one night. Let's see what will happen tomorrow." And then we called the coronavirus hotline. And actually, the day after, it was me who started feeling exactly the same symptoms. On the 14th, which was the second day for my daughter, we tried to call the coronavirus hotline, and nobody was answering. After hours of trying, I mean, my daughter was insisting. Finally, she managed to speak with an auxiliary nurse who, based on the symptoms described by my daughter, she confirmed, "Yes, Elena, you have the coronavirus. Most likely you have it. Don't worry. Doctor will call you back later." This never happened. And then the same was repeated the day after when I fell sick. I spoke with someone who was just recently hired, not even an auxiliary nurse or a person with medical skills. The person just started asking the symptoms. I mentioned all my symptoms, and then he asked if I have a fever. I told I don't, so he basically assumed that I don't have the coronavirus. He nearly hung up the receiver. And I said, yes, we have one in the family. I'm pretty sure that I also have it too. Then he just took my data and he said, "Okay, someone will call you back." And again, this never happened. Then we called for the third time, asking, because also my husband started feeling the symptoms like 5 or 6 days later. Then again, we asked for help. We asked for a test. We got promised something for the second or third time. And this just never happened. Nobody has called us. Nobody has tested us. It's us who have set our own diagnose, and also we speak with many people who are in similar situation, who have most likely the virus, have the symptoms. So basically, if you are a mild case, there is no way right now how to get tested or how to get professional help in Madrid.
How has the virus affected different members of your family? What's your experience been?
I mean, having spoken with the physicians who live here in nearby, our neighbors, there is a couple who is every day working in the coronavirus front line. I mean, really, my heart goes out to all the people who work on a daily basis in the coronavirus front line. This couple comes from time to time to see us and to check how we progress, etc., etc. So from speaking with them, we know that our case is still ridiculously mild. Basically, the big difference between a mild case and a complicated or a bit more complicated case is this gasping, this fighting for breathing. You cannot fill your lungs enough. You never have enough oxygen. You gasp. This we never had. But still, if we call our case a mild case with mild symptoms, similar to just a normal flu, we still have such a flu episode that I don't wish to my worst enemy. My heart goes out to all the people who are right now suffering the coronavirus. My heart goes out to people who sacrifice themselves, health workers attending them, because this is a really, really difficult and desperate fight.
How do you think this will change life for citizens in Spain over the next year? Obviously, once Spain hits the peak, there's still a lot of work to be done in terms of combating and stamping out the virus.
I think this will change people's life in many aspects. I think we have a very, very difficult year ahead. Once we will overcome this coronavirus crisis, I think this global pandemic will affect two major aspects of life. It will have both an economic aspect and a lifestyle aspect. In regards to the economic aspect, I fear that many small and medium enterprises will unfortunately not survive this global crisis. We all know already, we have friends, we have family members who work in enterprises, in businesses that we all know that will be heavily impacted. I'm thinking of my brother, my sister-in-law, who are working in the aviation industry. They are worried. They don't know what the future will bring. And then tourism will be affected so much. Meanwhile, I don't know, stimulus like the EIB is providing, bridge loans, etc., can help. But I do not really believe that there is any stimulus that will, on the short run, pull frightened consumers back into the restaurants or to the shops, browsing again, and let alone boarding a cruise ship. And I think that these activities and also the associated spending will just have to wait until the whole episode is past and we can forget about this crisis. Then I think we will also see a lot of work style changes. We will see more teleworking, more video conferencing. This is just one example. And now, as you are interviewing me, I'm sitting in my home in Madrid, and you are in France. You're in Metz, right? Or where are you calling from?
I'm in Paris, actually.
Regarding the lifestyle aspect, I think we will change many habits, like personal hygiene. I think we will wash hands more frequently and more carefully than before. We will sanitize our smartphones, keyboards. I recognize myself that I never sanitize my smartphone, but from now on I will be regularly doing it. These new habits will also be beneficial for keeping simple flu outbreaks under better control. I hope that vaccination will be taken more seriously. We have all seen these active anti-vaxxer movements in the past. I just hope that those will be played down, they will be overshadowed somehow, and those movements will be seen as harmful for the society. This is what I really hope.
The outbreak has put enormous pressure on European health systems, particularly in northern Italy and Spain. These places have some of the best healthcare systems in the world. Why do you think the outbreak has been so overwhelming? Is it just the sheer volume of patients, or are there things that could have been done differently before?
You're right that both Italy and Spain have one of the best healthcare systems, both in the European Union and the world. It has both countries have just the right size hospital capacity, Both countries have well-trained healthcare personnel, and they create very high value for money. What does it mean? This means both Italy and Spain are achieving longest average healthy life expectancy among the population, lowest avoidable mortality rate at lowest possible cost. This is important, the lowest possible cost. I mean, there are other countries with very good outcome, like the Netherlands, Germany, Belgium, etc., but also at high cost. But Spain and Italy are countries that create highest value for money. How this can be achieved? This is achieved partially by keeping the minimum necessary quantity of acute care hospital beds, including intensive care beds. We are speaking about bed occupancy rates of around 80%, which is not achieved by long hospitalization times. I mean, it's not that patients are being kept a long time on the patient so that they are occupied. No, this is that there is a high turnover, high throughput of patients so that hospital beds are always kept busy. This high efficiency of healthcare systems is very much needed, especially now in an aging Europe, where social security costs will be more and more strained in the future. In these times, I mean, the crisis times, this has been now counterproductive. Now, countries like Germany, having the highest number of hospital beds relative to population size, are the ones who could better cope with or are able to better cope with the coronavirus pandemic. We cannot predict the healthcare infrastructure that is needed for the next outbreak. Having unoccupied intensive care beds does not mean being better prepared for pandemics in the future. I mean, it was a coincidence that coronavirus outbreaks need intensive care beds and respiratory equipment. So those countries who already had it are the lucky ones because they can better cope with this pandemic. But we cannot know what will be the next pandemic. And pandemics preparedness is not about having more intensive care beds or even hospital beds unoccupied. Pandemics preparedness is something else. It's international effort. It has to be an international effort where a flexible team of healthcare professionals and equipment must be able to very swiftly go to the place where the outbreak happens. Once there, the healthcare personnel needs to have the proper personal protective equipment in place. So there must be some minimum preparedness. And this is what was lacking completely from most European countries, including Spain and Italy.
What can the EIB do to help? What's our role in helping hospitals get through the crisis and making sure that Europe is better prepared in the future?
The EIB is not a policy-setting organization. The EIB is helping existing initiatives. The EIB is designing new financing products. The EIB is defining, setting priorities, and the EIB is always there. And especially now more than ever, to have the world better prepared for the future pandemics. One thing is epidemic or pandemic response, and the other thing is epidemic preparedness. What we are now doing in coronavirus is response. Because we were not prepared, so we are reacting to a new condition. So we already know the bank has announced that it plans to mobilize financing to bridge loans and other measures to alleviate constraints in liquidity and working capital for SMEs and mid-caps. Then in addition, the EIB is using existing financial instruments, some shared with the European Commission. Now, in this case, most of all, the INOFIN, Infection Disease Finance Facility, IDFF, Infectious Disease Finance Facility, to finance projects that work towards halting the spread, finding a cure, and developing a vaccine against coronavirus. But again, this is sort of an ex post reaction to an already existing new situation. But the EIB has always been there also to finance preparedness. EIB services have been actively cooperating with a number of important actors in health, being the World Health Organization, the European Commission's DG Santé, the Bill and Melinda Gates Foundation, the World Bank, the Wellcome Trust, etc., on areas of high priority for public health. The EIB has been designing innovative financial instruments to effectively address underinvestments and seeking where resources can be additionally mobilized by third parties and donors. These days, while I was unable to work, I was fighting my own coronavirus infection. I was listening to a number of world lead epidemiologists, and they coincided in one thing. They described emergency preparedness as an international effort. We could call it as a chain, where every country is a link, and the chain is strong only when every single link is strong. It means that every single country in the world, regardless its wealth, should have a core healthcare system where there is a proper healthcare infrastructure, healthcare personnel, properly qualified healthcare personnel who is able to identify a new epidemic, able to diagnose people who have been affected by that epidemic, are able to attend the first cases, are able to communicate with other countries in seek of help, and are able to mobilize a joint effort, an international effort to combat the outbreak. This is the only way how the world can be prepared for the next pandemic.
Thank you, Tunde Szabo, healthcare economist at the European Investment Bank. This is Does This Change Everything? From the European Investment Bank, the EU Bank.